Well, once again, welcome to Payment Matters, the show where we discuss all things healthcare payments. I'm your host, Jeff Lin. Thanks for listening in. Today, I'm joined by our guest, Lew Trowbridge, Chairman and CEO of Canyon Road Advisors and former President and COO of Blue Cross Blue Shield in Nebraska. Thanks for being here with us today, Lew.
Pleasure.
Lew, maybe just a brief introduction about your background and your experiences.
Well, I started my career with the accounting firm KPMG. I was with them for 22 years, and towards the end of my career, I was managing partner of two offices, and I ran the Midwest bank practice, and I had quite a bit to do with the healthcare practice back in those days. It was a little different than it was today. I had one blue plan as a client in a major medical center. So I left KPMG in the early 90s and went into two different private equity ventures over the next 12 years. And then finally, I tried to retire in 2005, and that lasted about 2 weeks. And a friend of mine called me, and he was the CEO of a blue plan in Omaha, and he asked if I'd like to talk to him about being the CFO of the company. And I said I really wouldn't. I've run companies, I've done a lot of things, but I don't know that I want to be a CFO. And we had lunch and we talked, and the more we talked, the more excited that we got. And so I said, okay, I'll do this for a year, and that was 13 years ago. I was the CFO for 9 years and the president for 3. And now I'm running my own little company. I've always wanted to be the chairman of something, and the way you do that is you form an LLC that you're the sole owner of, and you have a shareholders meeting and you elect yourself chairman. So that's how I got to be chairman of Canyon Road Advisors. And I'm on some private equity boards, and I'm on the Instamed board, a couple other startups. I'm on a $900 million bank board, and I'm really enjoying life. I'm seeing healthcare and the health field from a completely different view than I saw as an executive of a blue plan, and it's been a lot of fun.
That's great. You've had a lot of experiences, clearly, from private equity to running multiple roles within Blue Cross Blue Shield in Nebraska. Why do you think healthcare is so for disruption and change?
You know, it's one of the few industries where the customer doesn't know what something's going to cost before they buy it. The system that we have in place in this country is just too loose. And I would say that if there was one thing we needed to do to tighten up healthcare to make it more accountable, would be to get rid of the fee-for-service approach and go to an outcomes, a value-based reimbursement model. We just can't go on paying physicians and healthcare systems based upon the number of procedures they do rather than the outcomes. That's not good for anyone. And I'm not saying that there are lots of physicians and systems that are out there just plowing processes through to be paid more, but the fact is that we just can't afford to do that, and there aren't a lot of countries in this world that treat healthcare that way.
Do you think it's reasonable within, let's say, my lifetime and your lifetime, where you think that is possible to make that change?
Maybe in your lifetime. I don't know about mine, but it's interesting. Medicare has put a mandate out there that they want to be 80% value-based by 2021, I think, 2020 or 2021. And from what I understand, they're going to get close to that. I think we have to make that change quickly in this country because if we don't, the costs of healthcare are going to be so great, no one can afford health insurance. And we may be close to being there now. All the people that are faced with a $10,000 deductible plan because that's all they can afford, and they can barely afford that. That's a tough way to offer health insurance to a major number of people in this country.
Yeah, we talk about healthcare being such a large kind of portion of our economy. I think 18 to 19% of our GDP. And with that being said, Medicare is not a small group either. So when you look at recent headlines such as JPMorgan, Berkshire Hathaway, and Amazon trying to get in and trying to disrupt healthcare, what do you think about that?
I think it's great. To be honest, the biggest problem that the payers in this country, and frankly the providers too, have in transitioning to a value-based system is their legacy system. I mean, how do you turn off fee-for-service if you're a physician? How do you go from being paid by the number of procedures to all of a sudden now you're being paid based on outcomes? And if you're a major healthcare system and you're a high-cost system, how do you make that transition? Payers don't have the systems to be able to provide the data to pay the various players, providers in the system on a value base now, and so those kind of things have to happen, but they have to happen quickly. And I think the market inertia that we have based on cost is going to drive us there. If you look at the example that you just talked about Berkshire Hathaway, Amazon, and JPMorgan, they don't have a legacy system that they have to transition from. So I could see how they could form their own insurance company, a mutual insurance company is what Warren Buffett has said, and just do value-based products and use Amazon for analytics. They could be a real market force. But I don't view that as competition to what we have now. They could lead the way for the rest of us to figure out how we need to get to value-based sooner. That's what I'm hopeful for anyway.
That's great. You look in healthcare across this entire industry as you look at innovators out there that are trying to disrupt the industry. And you see these accelerator programs, you name it. Yeah. It's been in vogue for the past 5-10 years. What's your current thinking or kind of assessment of how those innovators are actually disrupting healthcare, if at all? Yeah.
It's interesting. Over the last 18 months that I've been in my little Canyon Road company, I've seen probably 1,000 different companies, startups, and later stage companies, and there's some incredible innovation going on out there. But the real issue is, how do you get the innovators that have got these incredible ideas connected at the right place within the payer community and the provider community to make that innovation a reality and drive down cost or to raise quality? That's an issue, and there are an awful lot of people in the industry working on it. The other thing is, in order to change from what we have to what we need, it's going to take a lot of money. And in my humble opinion, the payers have to have a certain size or scale to be able to afford the innovations that are out there. And if you've got a bunch of payers that are on the small side, it makes no sense to me for each of them to do their own thing. Then we need to figure out how to get them to collaborate. And let's put the providers in there and collaborate with them as well. Provide the capital and do this together. This isn't about winners or losers, although there will be winners and losers in both the payer and the provider space. It's about making healthcare more affordable and keeping the quality as high as we possibly can.
There's a lot of talk about affordability, quality, bring a lot of constituents together. We talk about payers and providers. I think the third leg of that is consumers.
Yes.
And as that has grown in significance with high deductible health plans, etc. Talk to me about what you think the consumer experience in healthcare is today. What's your assessment of that?
I'll be polite and say it's not very good. I could also say it sucks. How's that?
But you see that with a lot of the innovation companies out there, which is, I'm going to change the consumer experience. What do you think is going to be important or strategic for a company to be looking at if they want to change that consumer experience?
Well, it's interesting. If you look at a member portal, which is what all the payers call their websites, I don't know any that have got what I would call a customer uptake on their websites of more than 3 to 4%. Why is that? Well, that's because the information that they're providing to their members through their member portal either isn't important to the member or the member doesn't see it as being important. We have to figure out what it is that consumers want to be able to control their health care, and then we got to figure out a way to give it to them. And one of the reasons that I'm on the Instamed board is that I'm incredibly positive about the new product, One Bill. Time and again, consumers, when they're surveyed, will say they want one bill in one place that they can see, whether it's they go to their doctor for an x-ray, maybe a broken finger, or they have a knee replaced. They want one bill, and they want to make one payment. Well, Instamed's got a product that can do that. And the studies that have been done show that when you implement One Bill, the uptake on a member portal on a payer goes up by 10 times. That's huge. So I think there's evidence out there that if we can provide consumers what they want, not what we think they want, but what they want to control, to better control their own health, to manage, I guess is a better word than control, it can work. And if a consumer is able to look at their health record, to look at the quality of their physicians, to look at what are the genetic things they have to worry about based on their family history, if they have that information in one place, readily available, I think that will go a long way towards consumers helping us keep the costs down. They won't put up with procedures that they don't need.
It's interesting as we talk about, you talked about uptake in terms of consumers, and that's always been the tough part in any technology company is how do you drive that adoption of any technology or process, etc. And I look at payers and how their position is unique with the lives of consumers and members out there. How do you think payers can actually proceed or increase adoption of these tools? What kind of tactics or strategies should they be looking at?
That's a very interesting question. It's interesting. Payers think they know what people want, and they build things accordingly. And I'm not saying that payers don't have study groups and they bring people in to talk to them about what they want, but it's very, very difficult to find solutions because they're not connected at the right level with the people that are providing the innovation. I'll just give you an example. When I was back with the Blues, we were trying to help communicate with our members through texting to help them when their scripts were about to run out or that somebody needed a colonoscopy or whatever. We could send them a text and tell them that these things were going on. Well, we didn't have anyone's cell phone numbers. We didn't ask for that when we signed them up. So we found a company. The company was called Relay. I think they're based right here. Yep. And Relay had a very simple product. They had a little sticker that you put on the membership card that a payer sends out to their members every year. It's kind of like a credit card. It said, call this number on your cell phone so that we know that you got your card. You didn't have to register, but it was honest. It said, call this number on your cell phone so we know that you got your card. And when the member called, the Relay people asked folks, okay, your card, glad you got it. Now, would you like for us to send you text? And like half the people said, yes, please. And then they had the choice of weekly, daily, monthly, every 6 months. And so we were able to very, very quickly get cell phone numbers and members engaged in giving them notices. It's interesting, but we had to fight to get our marketing people to adopt this program. And it was one of the highest uses that I've seen within the Blues, at least within our plan, in terms of bringing in some innovative new technical tools to use to help us connect better with our members.
That's a great story as you look at that. As we look at these industry giants out there, such as Apple and Amazon, where I think they have perfected consumer adoption. Do you think payers can compete against those companies?
I don't think we have to compete. I mean, I think you're right. I know what I want on my app for Blue Cross or Medicare or whatever. I want Amazon. I want Google. I want that experience. I want the retail. I want the ease. I think we work with those companies. I don't think this has to be a you or us. I think if we can bring that technology to bear within the payer system, everybody wins. So I would answer, we don't have to compete. Let's talk to them and figure out how we can do this together.
That's great. The last question here is, as we kind of think through this, there's lots of players in the industry. There's the innovators out there building a lot of disruptive technologies. And that includes the Amazons, the Apples, and the smaller companies out there, the payers, the providers, and the consumers that are out there. And then this makes up a large portion of our economy. Final thoughts on really kind of how we can actually make this work. What's going to be involved in this in order for all the parties to work together closely?
It's that's the core question, but it's incredibly complicated, as you well know. My answer to this is that if you look at the payers and the providers and the fact that they're bound with their legacy way of doing business, fee for service, and all the systems and claims processing and all that stuff that goes with it, I don't think you can change that fast enough from within. And I also think that we need to have a certain size, scale, to be able to afford these changes. So I think the lesson that we ought to be learning is to look at what Berkshire Hathaway and their two partners are saying. They don't have a legacy that they've got to transition away from. They're going to start from ground zero, and I don't know this, but I'm guessing that their new insurance company will be offering value-based products, so they don't have to transition. So if I'm in a company that's got the legacy fee-for-service business, how do I deal with that? I form a new company. I get other companies like mine, other blue plans perhaps, and they don't have to all be blue plans, coming together and investing in this new company to get scale, and then you cannibalize yourself with the new value-based products. I just don't think in a legacy environment like we're in within health insurance in this country, we can change from within fast enough to keep the costs where they need to be. Now, there are going to be a lot of winners and losers. As I mentioned earlier, you look at the provider space. The way this value-based approach to healthcare would work is that payers and providers would have to come together, and you'd have to have high quality and low cost if you're a provider to start with. But what if you're a high cost or a not so high quality provider? I think people will still give you a chance, but you've got a couple of strikes against you before you even start. And then, providers don't know how to do this. Most of the contracts that are in place today with the accountable care organizations provide for shared cost savings. There's no downside risk. It's all upside. For this to work, the hospitals have got to be at risk if they don't meet minimums, as well as if they exceed the minimums. And that's going to be difficult. I don't know of many. There are a couple of contracts out there that have both up and downside risk, but that has to be table stakes. And if you're a high-cost provider and or a low-quality provider, you've got concrete in your feet to start with. How do you get down to being average and then take it further? I've had people tell me that we're looking at probably cutting costs out of the system in the 30 to 40% range to be able to make this work. And that there's some people that aren't going to be able to make that.
Yeah, you said this is truly the last question here. You said the word cannibalize.
Yeah.
And part of this is that things will shake out when you get 30 to 40% cost takeout. Companies will die. New ones will arise here. How do payers stay relevant if that is the case?
Well, I think the payers that are able to transition to value-based, either through a cannibalization concept or somehow can figure out how to change what they have, will thrive. The issue is not capital, at least in my opinion. If you look at the public companies, they can print stock, and their stocks are selling at all-time high multiples now. If you look at the not-for-profit system, and by that I mean mostly the Blues, they are finishing off a couple of years where they made back most of the losses that they incurred in the first 3 or 4 years of the Affordable Care Act. So capital's out there. Capital in the Blues is just stuck in 34 or 35 different companies. So there's got to be some way to bring them together. It doesn't mean merger, but my theory would be if you had a group of 5 or 6 plans that could bring together 10 million members and they all put money into a value-based care company and cannibalized themselves, and as the fee-for-service business went down, people transferred over to the new company, or they were let go. I mean, you can't have everybody coming over if you're trying to save money. I think that over time we could make that work. It isn't going to be easy. In fact, I had one person I was talking to about this last week that said, not only is it not going to be easy, it's going to be brutal for a lot of people. If you're not into change, it's going to be brutal. But I don't think we have a choice.
Yeah.
The other choice is to move to a single payer system. And there are certain people that would say that's where we need to go. Talk to the people in Canada. Talk to the people in Europe. I mean, there are some issues with those systems that the government just writes checks to cover deficits in those kinds of systems, and you wait. There's rationed care. I don't know that our population should or would tolerate stuff like that. So that's kind of where I'm coming from. We don't have a choice, and I applaud people like JPMorgan and Amazon and Berkshire Hathaway for stepping up and looking at this. I was in Omaha for 35 years, and I know the folks at Berkshire Hathaway. They're smart people. In fact, I used to park next to Warren Buffett at the parking garage early in my career.
Yeah.
They're smart people, and having them step up and try to help by setting the example is a great thing. That's the kind of stuff we need, and that's what makes this country the country that it is. We're not bashful about it. Takes us a while. I mean, we should have been doing this 10 years ago, but we're at a point now where it's time to act, and I think we will.
Lew, thank you so much today for talking to us about your experiences across multiple industries and really how healthcare is really ripe for disruption. And those are the payment matters we're tackling today. Thanks for listening in. Remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. If you have a comment about this episode or show, follow hashtag Payment Matters or connect with me on Twitter at Jeff B. Lin. You can learn more about my show at healthcarenowradio.com or at instamet.com. Until next time, I'm Jeff Lin.